So, welcome everybody. We have a star-studded panel here of informed practitioners, and we are in the midst, as the healthcare industry, we are in the midst of a big storm. What popular perception may be that the healthcare industry benefited through COVID. This is largely untrue because hospitals were badly hit as elective surgeries went down, shrank almost to nil in the first quarter, and a government a mandate was also issued that elective surgeries should be avoided. And then they came back only slowly, and then because of the fear of COVID, even when the hospitals were ready, the patients were not. So the medical technology industry was also hit, and the healthcare industry is still shaking because of all this quake. Let me come straight to the point and discuss as to how demand can be brought back. First of all, in the hospitals, and then consequently in the medical device industry, with the help of the government and insurance players also coming in. So let me begin with Meenakshi. Meenakshi, how can demand be revived in the hospitals? Meenakshi.
Thank you, Pavan. Very good question. And as you said, hospitals probably in many ways have been hit the hardest. So I see it in two different dimensions. The first being, the sticking to the traditional model of hospitals, which is really when patients coming in for treatment. I think there's a lot that hospitals are trying to do, but there's a lot more that can be done to really inspire and instill confidence in patients that it is safe to visit hospitals. And I think the fundamental discussion there needs to be, I mean, every single patient, I believe, is making the choice of which is a bigger risk. Is COVID a bigger risk for me, or is it better for me to treat my condition so it doesn't get worse, right? All of us are making those choices. And I think where the hospital can make a big difference is in informing that choice by really giving them the confidence that the hospital is a safe place, is a clean place, that COVID management is top class, and that no infection goes undetected. So I think there's a massive role that hospitals can play, and I do believe many, especially the chains, but even smaller hospitals are really trying to do that to bring patients back. I think the other more challenging piece is really for hospitals to recognize and almost redefine their business model, because what we are also seeing is a lot of the center or the hub of healthcare, which historically was only in the doctor's chamber or in the hospital, is now starting to get set up in homes as well, as more and more patients and people are getting into digital consultations, digital treatment, digital monitoring, and in many cases even digital care, right? And how do hospitals redefine their business model from being just that physical building where they deliver care to being the brand and the equity that delivers care wherever the patient wants care to be delivered. So I think that is another fundamental change that I do believe many hospitals are trying to make, but that's going to be the second big shift that will have to happen, to stop thinking of hospital like a physical building, but starting to think of hospital as a continuum of care, which needs to be given wherever the patient wants it. So I think, and both are very big points. So I'm saying it in a very, as if it's very simple. I know it's very challenging, but that's what I think has to happen. One, inspire confidence in patients that that physical building is a safe place to come to. And second is redefine the model beyond that physical building, if I can call it that.
Excellent point. And let me come to the first point, the second point first. The digital piece and telemedicine has really shaken the way healthcare may happen tomorrow. And this is not only because why telemedicine has uh, brought relief for the patient. He doesn't have to travel, doesn't have to wait for the doctor, etc. The doctor's cognitive load is also reduced because he has everything available, all the list of allergies, etc., which when he's prescribing. His waiting room pressure has gone down, and it has benefited the government also by making sure that less doctors still will do now, and the payer also who will actually pay less. So telemedicine is really going to change the epicenter of health or take it to other places also. And another reason why they are saying that telemedicine is picking up in India so strongly is because there is the dignity of the patient which is maintained better through telemedicine. The patient often comes across some doctors who may be arrogant, or the behavior of healthcare workers in the hospital may be arrogant, which is why also research is showing that telemedicine is being flocked to by the patient in droves. Just as in the e-commerce industry in India, many people are boarding that e-commerce wagon from the lower economic strata, disproportionately high onboarding, because they do not get the right treatment by the shopkeepers in the mall as well as fellow shoppers. So this is an omelette which will not turn back into eggs. So telemedicine is bringing a big thing inside into the health space. And here is where I bring in Rohit to talk about this, and then I will go to Vivek to speak more about the first point which you made, Meenakshi. But Rohit first. Rohit, your company
Yeah.
is really at the forefront of this telemedicine piece, also e-monitoring, etc. Tell me how it is changing the landscape and how hospitals can tap into this demand. Rohit.
Yeah. So I think one of the things that the pandemic has done quite well is introduced us to the virtual world. So we've learned to move away from the physical world of touch and feel to the virtual world. We've learned to trust it. We carry out big negotiations sitting across. We are having this particular webinar. It's a webinar, okay? We have not done so many webinars. So I think we have learned to appreciate the value of the virtual interaction. And that is when diagnosis and treatment that the hospitals considered and the doctors would say, hey, I need to touch the patient to make a diagnosis. I'm pretty sure that holds an important point, and I'm not a doctor. But I think how you monitor patients, how do you provide your diagnosis and your judgment across miles and miles of just ether is something that is now accepted, and that's possible. So what do we have as technology? I mean, the whole digital backbone is something that we can leverage to do telemedicine. Not just telemedicine where you're providing a diagnosis, you can monitor machines across the digital space. You can have EICUs, which means that an ICU is at a location and the command center is in another location, geographically different. And you don't necessarily have to have talented intensivists at that remote location, let's say in tier 2 and tier 3. You can continue to do it through your tier 1 center where you have sophisticated and more qualified doctors. So EICU can be done. Okay, telemedicine we already spoke about. E-monitoring can be done also, which means you want to set up a patient in their home with critical care equipment and provide the access to the hospital to continuously monitor what's happening, not through phone calls or something, but through actual information that goes from those machines and monitoring equipment directly to, let's say, the phone of the doctor or even to the command center in the hospital. Those are things that are possible. And it's not just possible. Those are things that the hospitals demand today, patients demand today. So the hospital, as Meenakshi mentioned, is no longer the center where you get all your healthcare needs. The hospital has found a way to virtually go to the patients to provide diagnosis and treatment. And our technologies and a digital backbone definitely has enabled this.
Great. Superb point. Vivek, your Medikabazaar, it seems, is now going to cater to a much wider catchment area, because what Rohit and Meenakshi are saying is that the epicenter for healthcare is getting dispersed. It will not be only the hospital, but it will be the home piece also, and maybe micro hospitals which will emerge which are distributed throughout the urban tissue, because we saw during COVID, even condominiums were purchasing ventilators and what was it, oxygen concentrators, Vivek?
Yeah, yeah.
Go ahead.
Sure. So coming back to certain changes, what this pandemic has brought in, and I think Rohit, covered these points beautifully, in terms of explaining the realities of getting into virtual world and physical distances, being created in the overall, healthcare or whatever, any sector or any place we talk about. So, just to give you some cue on how things change at our end. When we started, way back in March, suddenly, we saw a lot of traffic building up during March. And since we are a digital company, we use a lot of digital and supply chain interface to reach out to our customers. The target customers are primarily from tier 2, 3 cities. We have close to about 80,000 medical centers and smaller centers registered with us. So when we actually started seeing a lot of traffic building up, which was like 2 to 3 times of average traffic, we could really understand that the shift was there to, to make sure that there is high digital, penetration, which is driving the demand now, especially looking at the requirements of the care centers, or whether we call these hospitals, or whether we call them as typical, as you said, as a micro care centers, or whether these are home centers, because home quarantine was one of the big, subjects which was discussed, and everybody wanted to follow that. Nobody wanted to rush into hospital, and doctors even prescribed the COVID patients to be home quarantine. And when they were home quarantine, obviously there was a lot of demand building up. Everyone started buying. So we designed a specialized kit, kind of a COVID kit, which was essentially needed by patients, which included a basic system in place. Even people bought oxygen concentrators at homes to take care of their, maybe elderly patients, or patients who could be fragile enough to get into higher symptoms or better, kind of care requirements. And then people wanted to avoid hospitals for obvious reason. Either hospitals were either fully packed up, or there were no beds available. Many hospitals were not even COVID centers also to look at. So that's the shift in demand which we actually saw building up, more from physical demand to a digital demand. And then we had to meet that obviously with more supply chain interventions. And that's how the shift happened in terms of building more digital, kind of demand, pushing, the different kind of shift from hospitals to smaller centers, to home, to different kind of quarantine centers, or pandemoniums, or whatever, we see across societies and all of that. So a lot of shift happened, within the way medical care was being looked at. So we certainly, we added to, overall, meeting up the overall demand and tried to fulfill that with our intervention. But this is the shift what we actually saw through in the digital area, especially looking at the COVID situation.
Yeah, great point. So, Sumeet, so far what has been discussed is demand has got shifted. But let me ask you this question. Has demand also shrunk a bit? Because some surgeries like bariatric surgery or cosmetic surgery, these are simple surgeries or not necessary surgeries. They have actually gone off the register. Then non-COVID treatment also took the back seat, and COVID was acutely ill, but not very intensively monitored or diagnosed or conditioned for surgical goods consumption also. So and plus the paying capacity of the patient also may have gone down, because so many millions of people lost their jobs. So what is your feeling how the hospitals can still build demand or re-get it, at least to a point where they can sustain themselves, of course, co-opting the home healthcare piece also, which has been spoken about. Sumeet.
Thanks, Pavan. So yes, the demand has definitely shrunk during this time, during the COVID pandemic, and there's no doubt about it. We see the hospitals hurting, and that's I still want to say that there has been a disproportionate amount of resources and thought that has been given to COVID, and it should get that. But still today, what is relevant is that there are still 2.7 million deaths caused by heart attacks in India, 800,000 deaths caused by cancer, and again a million or so caused by diabetes. And still, if we were to extrapolate the data of COVID mortality in India in the 6 months, we would think of it as a disproportionate amount of resources being given, but unfortunately, it has also disproportionately affected the revenue streams of hospitals, right? So I think there's a lot of pent-up demand which is sitting out there, which is going to come, and a lot of there's some very startling statistics around the fact that a lot of oncology patients didn't get their treatments. A lot of polio vaccinations didn't happen during this time. So I'm very confident of the fact that demand will come. Now, whether it be in a hospital setting or in a home care setting, let's see. I think India is still not ready for home care to the extent we see it in the Western world, but I think it's shifting. The paradigm is shifting a little bit, and I think that will catch up. But I think for hospitals, the heartland of India lies in tier 3 and 4 cities. I think creating access and affordability will be key for hospitals. The cacophony around mistrust that is happening with the hospitals has to change. They need to focus on value, and value is, as you make outcomes better by reducing cost, value is driven. And I think if we were to look at it from a company which manufactures hospital beds, I think what we have done is that we are reducing the price of our offerings. We are packaging more to make ourselves more relevant. And I think that is where I feel the pent-up demand and the access to tier 3 and 4 cities. And I agree with my fellow panelists that when it comes to technology, that will be a game changer. Things are changing. The regulatory framework around having digital appointments has very much come. Digital prescriptions, I think, is on the way. So all that will come and change. But I still think that the next in the short run, I think still treatment will continue in hospitals. And I don't see the demand with medical tourism as well. With the travel resuming, India is one of the largest medical tourism hubs. And I think that will also come.
So great, very well summarized. So basically what the four of you have said is that demand is surely shifting, epicenters of demand are shifting away from the hospital also. Demand has also shrunk to some extent. There is but pent-up demand for procedures which have not happened, which may come up now. And things like travel, etc., easing will also bring back the demand in the hospital through medical tourism, and not only international medical tourism, but domestic medical tourism also, which is also halted right now. Coming back to Meenakshi, given all these points, and the first point which you made, that the hospital demand has to be revived by building patient confidence and also doctor confidence. What are the ways in which the medical technology industry can stimulate demand for their products and equipment? Meenakshi.
So yeah, thanks Pavan for the question. So I think what we heard across the group of us, right, is one is the location of demand is changing. The second, we talked about the nature of demand is changing, and we talked about the pent up demand. So I think from us as an industry, I see maybe three responsibilities that can really help meet this change. I think the first is around, and I think that to an extent I have to complement our industry, I must say, because we've been able to keep the supply chain very active and very alive throughout the pandemic in spite of all the challenges, and that remains a big responsibility for us. But keeping that alive and active in a way that, even if there is, for example, in our business, even if there's just earlier where we used to do 7-8 surgeries a day, now we might be having 1 surgery a day, but we still need to keep that entire infrastructure of service and support up and running to service that 1 surgery, and that is our responsibility. So I think that is something that we can definitely do a lot of to keep the demand alive. I think the second is and some of my colleagues here I know and have businesses in that area, is really looking at financial support to the hospitals so that it becomes a true partnership in the sense that there is some skin in the game on both sides. And we are in the business of medical furniture, we're in the business of cameras, we're in the business of robotics. And what we are finding with our customers is, while they all want to upgrade capital because they see this as an opportunity to come out of the lockdown stronger than when they went in, so it could be a competitive advantage, so they all want it. But the paying capacity, even if it's there, the uncertainty of volumes is very high. They don't know when the patients will come back. So putting that big money now without knowing when the volumes will come is a big risk for them. So how can we risk share beyond just financing and deferred payments? We need to think quite creatively. Can we link it to volume uptake? Can we do some moratorium so that they only pay when their volumes are back up to say 30-40%? So we'll need to think about these kind of I don't want to call them financing options because that sounds very simple, but it's really much more of skin in the game options, so that together we can go for the right technology, the medical device company as well as the hospital, so that the entire burden of the cost is not on the hospital. So I think that's probably another role that we can play. And I think the third thing I'd want to highlight, and many of us are working in those areas, is how do we continue to come up with new products and services that is meeting the need of the hour. So in our case, for example, we've really stepped up our efforts in the area of OR integration, because now specialists are not able to travel to tier 2, tier 3 towns, but yet they can assist in surgery in those towns through integrating different ORs and really, almost simulating the surgery in a different setting. So there is a need for us to not upgrade is the wrong word, but there is a need for us to really qualify our products so that we can enable this digital surgery management in a much better way. So I think a lot we can do, but I'd summarize in these three ways. One is qualifying our products to be a lot more technology friendly. Second would be the skin in the game partnerships. And then third will really be, working with the hospitals to inspire confidence in patients.
Superb. Excellent points, very comprehensively rounded. You have mentioned that supply chain, despite logistic costs, what you alluded to also, logistic costs going up, the cost of not only the tariffs, the freight rates, but also they had to be all the expense had to be made in circumstances which or in situations which had to be made completely aseptic. So that we have that the industry has been able to do financial partnership. I remember, I'm just reminded that when Boeing and Airbus launched, that time also it was a very slow phase for the economy. So they realized that airlines will not be able to buy our products to that extent. So they came out with financial support models, and on that I am going to ask Rohit something. And the third thing which you brought is teleproctoring. So teleproctoring by doctors, so that the procedures which are being done at a remote place are well monitored and regulated from quality point of view. Excellent points, Meenakshi. Rohit, what Meenakshi referred to is already to some extent practiced by companies like GE Capital and your company Philips. Tell us about it and add to what else can be done by hospitals to by medical technology industry to stimulate demand. Rohit.
Yeah, sure. I think Meenakshi mentioned it, and it's this is a time when hospitals, when their top lines are shaved off, even if it's 20% or 25%, that is a direct hit to the bottom line. So the cash flow does take a hit. This is a time that we must partner, and if there is a strength of our balance sheet and the hospital's balance sheet, then that needs to be leveraged together in helping the hospital move on in its journey to become a little bit more sophisticated to get the right outcomes for the patients, right? So we do have Philips Capital, in Philips that is able to leverage the strength of the balance sheet over here to provide funding to the hospitals for, whatever purchases they need to make. But more than that, that's plain vanilla financing. Right? The banks do that, and BFCs do that, and Phillips Capital can do that as well. But I think our strength comes in where we are able to consult our partners in the healthcare delivery space on their operations, to actually notice and to provide them solid management consulting in terms of what is going around in their hospital and how do you bring down that cost. And after doing that, how do you partner with them on risk? Our solutions are specifically defined as solutions or as initiatives where we are able to partake of some of that risk. Because of our understanding of the healthcare system and our healthcare and the healthcare delivery as well, we are able to find a win-win with the hospital to say, hey, how can we share the risk? How can we bring our knowledge base, our management consulting to your doorstep so that we can take an informed risk so that we go along with you and you don't have to share the burden of more than what you should at this key juncture. So it is not a financial solution. I agree, Meenakshi, we don't call it a financial solution at all, but it is true partnering. True partnering is about true risk sharing. And how do you do pay-per-use type of models, or like I said, do management consulting, find out what the operations are like, and then move hospital in those ways. Now, this also includes leveraging our big strength in connected care. When I say connected care, that is leveraging the whole digital space out there for making the hospitals as effective as they were before the pandemic. And this is, like you mentioned, it's an omelet that can't go back into the egg, right? This is a journey that we are on. And digital is going to shape quite a lot of the treatment protocols and everything that the hospitals must sort of, morph into in these times when physical contact is going to be so low. So how do we provide those solutions using the digital space? The connected care solutions that we have are the ones that will continue to help hospitals to reach their patients, virtually touch them, provide them all the services that they need, and keep track of them as well. Okay, so that if they are to come back after a year, 2 years, or to go to another space, their records are maintained and all those kinds of things, right? So these are two ways: partner, risk share, and the second is leverage our connected care model to provide value to the patients and to the hospitals.
I'm fascinated by this connected care piece. And if you see, this telemedicine is such a thing on the table, which is benefiting the customer, the patient, the doctor, the payer, the government. Everybody is winning. And the only such instance where everybody was winning, I can remember, was when Henry Ford came with his assembly line model, which improved the wages, reduced downtime, reduced number of working hours for the worker, reduced the costs, and increased the profits. So surely I would like to underscore, as you did also, this omelette is not going to turn back into eggs. So coming to Vivek, Vivek, you are actually at a unique space between the medical technology industry and the hospital. What is that space, and how you are seeing that demand can come back for into the hospital through innovations which you are making, as well as what the hospitals or medical technology industry can do. And after that, I will go to Sumeet to round up this round, and then quickly move to the insurance and government piece. Vivek.
Sure. Thank you, Pavan. And let me just start with a point that as Medikabazaar, and since we work on both provider side as well as manufacturer side, it is also our primary responsibility and kind of need for making sure that our customers, that is the hospitals, the health of hospitals are taken care of. When we talk about health of patients, obviously it is important to also make sure that providers' health is also taken care of. And we are certainly started contributing to that health in a very big manner. Let me explain you how. in the month of March, we recently, introduced one of our intuitive procurement management tools, which is now becoming kind of acceptable tools within hospital. And this is more to do with their micro planning. Hello.
Yeah, go ahead.
So, which is more to do with their micro planning on inventory, as well as looking at their consumption pattern and deriving something, which can really help reduce the kind of burdens they have on the inventory side. And this is designed basis the data which we gathered over the last many years of our dealing with hospitals, with more than 10,000 hospitals data spread all over the country. In fact, Medikabazaar runs a data science center also. We have technology center of excellence as well, which is now where we're investing and trying to build a very strong interface in terms of understanding the data, consumption level data within hospitals and to the point of care, in fact. And I will explain that more with what we are trying to do. So what we are, first level is what we are trying to understand is their consumption data, and based on that, how much rationalization of inventory can be done and how much Medikabazaar can help in terms of reaching out to hospital in the best possible manner with the supply chain intervention, what we are doing all over the country. In fact, we have now 26 full-fledged distribution centers all over the country, and we are investing on supply chain efficiency as well. So that's the one point where we are really helping hospitals in terms of reducing the burden on their side in terms of working capital, in terms of maintaining cash flows within such limitations of revenue generation, and that's how we are going to help them. On the other side, we are also getting more downstream in terms of management of inventory within their department. We recently filed a patent, and we are also looking at certain kind of IoT devices intervention within departments, which can really help hospitals maintain best level of operational efficiency within their stores to their individual departments also. So basically, from stores to departments, how an IoT intervention can really help maintain the seamless inventory flow is also what we are trying to provide to hospitals. So in the given context, when we are talking about health of hospitals, as Medikabazaar, because hospitals are our primary customers, we are really trying to help them. In terms of demand generation, we are really, putting all our best effort in terms of making the best options and products available to them, from the manufacturer's intervention, from the different, kind of disease therapeutic intervention, so that we can really enhance their revenue. We introduced many such products in last 5 years of our journey, which was maybe not available in India, or which could have really helped hospital grow revenue on their side. And even post-pandemic, we are coming back full throttle with certain number of options of, different treatment options or revenue options or alternative, kind of management options, which is really driving them increase some part or other part of the revenue. This is how I think we are contributing overall in terms of demand generation in hospitals, more with technology intervention to make them much more healthier than they were earlier, and definitely trying to augment their revenue by putting more and more technology, medical technology per se, through digital intervention to make them really increase their revenue side of it.
Excellent. I think Stryker, Philips, GE, Medikabazaar, Acnamed, Stratmed, all these companies are proving that how they are actually helping the hospitals in improving their game or coming back to health. What Rohit mentioned was they can even spot where are the wastages, where is it that cost savings are possible without reducing the quality outcome. And you spoke about IoT, and there is a recent study which says that through just simple sensors put on devices, one can reduce the 24% of time which nurses lose in every shift just looking for devices. So just a very simple sensor which will beep the moment you name that device, and you will be able to locate that. This adds to a lot of savings in terms of nurse wages, but also they lead to faster turnaround times for beds and better patient care. Great points. So Sumeet, what does what is the hospital furniture industry or medical technology industry, as you wish to bat the pitch on which you would like to bat? How is it improving demand for hospitals or helping them come back to health? Sumeet.
So, as I mentioned, I think the old age adage here of access and affordability are the two things which have to work together in India, right? So, I think one of the key things that we are working on is to really see how we can improve access for a lot of the patients who do not get care. So, how do we make our products more affordable, right? So that we can have it go to the tier 3 and 4 cities of India, which is where the heartland of India is. So if you look at that, there are certain features in a product which a tier 3 or 4 city requires. So one is to customize to those cities and their demands, right? And then look at what is required in tier 1 and 2 and invest in technologies in manufacturing that will allow us to provide that to this to these various tiers, right? And that is something which we are proudly able to do here in India. We are a proud manufacturer in India, Atmanirbhar Bharat, as they say. And so we are really trying to incorporate certain things like I said, average length of stay, right? How do you get your patient back on the feet, right? For any COO of a hospital, they concentrate on ALOS, right? That's the term they use. How do I help you be successful in reducing your ALOS, right? What kind of beds can I provide you? What kind of placement in a hospital room can I do, which will help you recover faster, right? The other second thing which a hospital COO will concentrate on is average revenue per operating bed, right? So you want to increase revenues while also decreasing cost. As I said, the value comes from improving outcomes and reducing costs. We are the preferred partner of choice here in India. Again, as I said, we have an offering which gives any hospital that ability to have a solution like a bed over a 7-year life of a bed at 2 rupees per day. I mean, that's something, right? I mean, 2 rupees per day, all the way to 170 rupees per day. We have that offering of a bed in a 7-year useful life. Although our beds last for almost more than 10 years, but I'm just taking what the depreciation from tax side is allowed. So this is where I believe we are investing in technology. We are doing it in the manufacturing part of things, really customizing our solutions, making sure that we get to the underserved segments of India, right? And obviously there's a replacement opportunity, but there's a new opportunity that sits out there with 1.7 million beds. We are barely at 1.2 beds per patient. The WHO standard is around 3 beds per 1,000 patients, right? Or 3 beds per 1,000 population. So there's a long way to go in India, and I think by doing what we are doing, we are going to capture that demand for hospitals and for us as well in that.
Excellent point. In fact, what you have said, that you are tailoring the product to newer markets like tier 3 or tier 4 cities reminds me of the refrigerator market. When it had saturated, they decided that can we reduce the size of the refrigerator and take it to every hotel room and dormitories. And then they realized that they have really expanded the market after they had developed that small fridge, which you find in every hotel. And that was a very big, it gave a very big additional sale of refrigerators. So you mentioned ARPOB. I was thinking that if they had also gone with some acronym, it would have been ARPH, average revenue per home for the refrigerators, but it would have stayed the same ARPH, average revenue per hotel. Okay, and then they swarmed the hotels. So great points. Let me come back to Meenakshi. Meenakshi, what is the role that insurance can play in increasing demand?
So, Pavan, lots to say on insurance. And I think for us as an industry, this is a key pillar. As it develops, it's going to make a huge difference. And why do I say that? I think the first is just given that a lot of our kind of healthcare in India is all private healthcare. Yes, there is the government healthcare, but there is also private. I see insurance playing three roles. I think the first is just basically, coming out with more and more schemes that can really stimulate a demand for insurance. And I think people have now realized the importance of having insurance policies for situations like COVID. Just like everyone is now taking vitamin C, D, zinc, it's become standard in every house. I think insurance policies will soon also become standard in every house across all age brackets. And what I find is, the insurance policies are, yes, they are there, but they are quite restrictive and they're very specific on preconditions and, for the elderly, and they are very limiting for those groups of people. So how do they open up their slate so that even the elderly with comorbidities can get some insurance scheme because they are the ones who probably need it the most? So I think that's one big piece, which is really, kind of coming up with a lot of new products and insurance packages. I think the second area, which is kind of linked, my second and third point, is just for context. We are in the we One of our key areas of products is orthopedic implants, and we have some new technologies that really allow patients to get treated and potentially they could be discharged within 24 hours. But what we find is hospitals are unwilling to take up those options simply because the insurance policy is, requires at least a minimum 24-hour stay in hospital. And I think that's where I feel the insurance industry needs to keep step with some of the developments in technology in two ways. One is what we discussed earlier, as more and more healthcare happens out of the hospital, how can insurance support that and fund that? If it will only fund healthcare in hospital beyond 24 hours, it will not be supporting a large part of healthcare. So that is one piece. How do they keep step with their policies to support healthcare outside the hospital or be within the 24-hour period? And the second is also allowing patients to access premium technologies by allowing the insurance policy to pay for that. Right now, for example, if you do a knee surgery, it's just a flat reimbursement. So there isn't enough incentive for hospitals to use newer technologies to do faster, better, more precise surgeries because the premiums will be the same. So again, how do they tier their packages, make it a lot more price elastic in terms of policies that really allow those that can to take up the new technologies? So a lot can be done at the basic level. It's to stimulate demand by really opening up policies for the elderly and those with comorbidities. And the second would be really having lots of different shades of policies that allows for home care or daycare or better technology access for patients.
Again, very, very comprehensively covered. What you have said is COVID has expanded the insurance market. And let me add to it, the COVID has also expanded their bottom lines in a very big way. They have had a windfall this year because elective surgeries shrank. So the outgoes were very low as compared to earlier. And then you have said that menu is very limiting.
Yeah.
The insurance offerings are very limiting. Then daycare is not available, out of the hospital care is not available. And I feel that insurance companies, especially after this year, the windfall gains can accommodate those, and they are already working towards those. Now we have heard, we've come to know that onco care and dialysis care is now available in some insurance platforms, plus the premium technology piece.
Yeah, and
Editing,
I would add one thing, Pavan, is that, and we were talking about this earlier, prior to this conversation, is even all of us in this webinar and in general, our allocation of how we spend our money has changed a lot. And many more people are now going to allocate a much higher share of their disposable income to health, because that's what we've kind of done over the last 8 months, and 8 months is enough to change habits, right? So I think people are now willing to buy policies that are more fuller, that are more richer, that give a lot more access. So the timing is perfect for insurance companies to launch those policies because the demand for that is there. People will put more money on health today than they did 8 months ago because the importance of having that cover has really come to life.
Agreed. Absolutely. Very well rounded point. So, Rohit, would you like to add anything to this, to the insurance piece? Otherwise, we move with you on the government piece, how government can promote demand. Rohit.
Yeah, no, I think Meenakshi's covered insurance quite thoroughly. So, let's look at what government does, even given the time that we have left. I think government, does play a very critical role in increasing or impacting demand in the hospitals at this time. It did earlier also, whether it was, the price control or whether it was Ayushman Bharat pricing. I think these are things that impact the passage of patients into hospitals quite a lot. So I think government has a responsibility, a big responsibility in how it shapes its policies, especially at the time of a crisis, because at the time of a crisis, you don't have the leeway to consult people ad infinitum and come out with something that's going to please most of your stakeholders. You cannot do that. You have to fight for the rights of the patients, and that's what probably the government is doing by sort of blocking a certain number of beds for COVID patients. They're doing that, but they need to be careful that the army that's fighting for COVID, okay, needs to have their lunch as well. They cannot sleep on an empty stomach. So the hospitals need to be viable at the end of the day after treating all the COVID patients, and then still have enough to treat the non-COVID patients, which have not been going to the hospital so much. Elective surgeries have dropped, as we heard. So I think a very, very important role. We just saw, in Maharashtra, for example, there was a 80% beds were blocked for COVID, and then the Nagpur High Court actually overturned that and said, hey, no, listen, they should get paid fairly for what they are treating. So those are kinds of things that actually set us back. So how do you take quick decisions where patients are benefited, but the healthcare providers also are able to maintain that quality of treatment? And the second place, I think, is we all know, and we've spoken about the gross mismatch between the capacity to treat and the disease burden that we have. And the government actually made a big move in February by calling out the health cess. And now that health cess, which is almost 5% of everything that gets imported, for viability gap funding. Now that hasn't been picked up with a lot of gusto in the tier 2 and tier 3 cities under a PPP model. But if that were to happen, then Ayushman Bharat itself, which has, I think, a shortage of almost 2 lakh hospital beds, would have suddenly started springing up, and private players under the whole PPP model would have started taking that up with a gusto, and you would have seen a lot of construction happening. But we actually have not seen that happening. So, I think the role of the government over here also is they've made a good policy. They probably made this. It hurt us. It's going to hurt the patients a little bit more because they're going to have to pay more. But this is finally good from an infrastructure increase perspective. But, it's a good deed which is not bearing fruit at this point in time. They really need to introspect to see how are people going to be able to make use of this. Is it just the capex that they should be funding, or is it a little bit of the operating cost that they need to fund for maybe a couple of years also? And there are lots of models that exist out there, which they should make use of. So I think these are two places where the government plays a huge role, and they should, practice their responsibility very, very carefully.
Yes, you're right. You have said that the government policies should be more thorough, more, it should be a watertight case. Now, for example, in the 5% health cess, which has increased, actually it is not just a 5% increase because the exchange loss has happened. That means the rupee has depreciated. So the total increase of cost of goods during this time when the patients needed is more than 10%. Where the rest of the world, custom duties have been brought down, cesses have been brought down, and we have brought it up. Not also realizing that the industry has completely been with the clarion call given by the Prime Minister and his cabinet that we should preserve jobs. So we have preserved jobs. But would the stamina for generosity on the part of the global managements not shake when they feel that they are funneling in funds to make sure that the jobs in their organizations are preserved, but 10% of that, because of the government's health cess, is going into the government exchequer even at this time when their own companies are bleeding. So, and where nowhere else in the world this kind of tax has come up on their generosity. So, great point, Rohit. Vivek, what would you like to add from the government side? How government can enhance demand or bring it back? Can't hear you, Vivek. Yeah, Vivek.
Sorry. No, I said absolutely. Rohit brought in some very valid points in terms of government intervention in bringing the demand in healthcare and also supporting healthcare. Let me also add some more colors or perspective to this. So, with a suboptimal spend in healthcare, less than 2% of GDP is spent on healthcare. Government has a limited budget, and it's primary and fiduciary responsibility of government towards different sections of the society, right? And you can't create and kind of omnipresent, healthcare budget or the structure or plan around meeting the different needs and sections of society. So I think there is deeper thinking required in the way this problem is addressed in the country today. There is the private healthcare primarily, shoulders the real, responsibility for healthcare delivery in our country. We have to understand that fact. 74% of healthcare spend is private healthcare. And we just can't ignore private healthcare. We just can't be pushing things back to them. We have to realize the reeling pressure in private healthcare. It shoulders the burden of so much employment around. The second largest employed people, are part of the healthcare sector. So we have to really understand the challenges faced by private healthcare. It can't be a plain and vanilla policy from the government side. We really all welcome the plan like National Health Authority or universal coverage like Ayushman Bharat. But with a very dismal budget, what we discussed and what we really understand, this can't, take the burden of the kind of coverage it is supposed to do. So I think it is important, and everything starts with budgeting, right? The government has maybe all the intent to do things, but budgeting has to be appropriate. As you rightly mentioned that, you can buy Rafale is also, you can buy, different defense equipment also, but there has to be serious thinking towards, healthcare delivery and the disease burden we are going through in terms of looking at the population we need to cover in our country. So, these are few points which I just wanted to add to more towards, what government thinking is. And I'm sure that, we will see some good, welcome moves from the government in terms of understanding the need and requirement of the present healthcare infrastructure, as well as the move towards, certain private healthcare opportunities which can coexist within the country today.
Excellent point. Sumeet, what would you like to add to this? What can the government do? And would you like to elaborate on the Rafale piece?
Sure. So just building on what Vivek said, I think the government has, again, in many countries, if you look at the payer, right, the government is the largest payer. And if you look at India, we are talking about healthcare policies from insurance standpoint, but really the path to universal healthcare coverage is incomplete without the government playing a bigger role. And Ayushman Bharat obviously is got a very meager allocation of 6,400 crores. And again, just to put some numbers in place, which covers 50 crores people, 50 crore of our population, and 5 crore people are admitted. The allocation is about 1,250 rupees per patient, which is equivalent to, two medium-sized pizzas, or equivalent to what Geo captures as a revenue on the mobile piece across India per person. But putting that aside, I think what the government can do is really think of new models, right? And I think, as a peers system or looking at ways in which they offer healthcare, they need to look at population health management. And I want to draw an example of a company which has done this beautifully in the United States by the name of Kaiser Permanente. Right? Kaiser Permanente has 39 hospitals with 10 million members that they cover. But how do they do that? Technology intervention by focusing on health and not healthcare, by counseling their patients, by making sure that the insurance, they are both the insurance provider and they own the hospital, so they have the incentive to keep the patient out of the hospital. So I think that kind of model is required, right? 39 hospitals catering to 10 million members. Beautiful. I mean, how can we replicate some of that in India is, I think, what the government needs to understand better. I mean, they have to really see some of these models and really look at what we can do in India, because that's the clarion call for the government to really come up with a model which will really be disruptive that way.
So thank you, Sumeet. That was a very, very good intervention by Vivek and you. Both of you alluded to the fact that defense expenditure is important. Surely it is important, but so is health expenditure, because if defense is not done well, then people lose lives, but so is the outcome if health is not done well. And the war theater is important, but operation theater is also important, and the expenditure on healthcare should surely go up. So, great points all of you made, and it was a very rich discussion, content rich discussion on how the hospital industry, the medical device industry, the insurance, and the government can revive demand, make sure that the hospitals and the medtech industry stays viable to serve the patient. Thank you very much. Very enlightened audience and a very enlightened panel. Thank you very much, all of you. Bye.
Thank you.
Thank you.
Bye-bye.
Thank you, everyone.
Bye-bye.
Thanks.
Thank you.
Bye.